Most men open the Restorex device for the first time and immediately think, there's no way I'm putting that on correctly. And honestly, that's completely normal. Because when you first take it out of the box, it can look pretty intimidating. There are rods, there's a clampy bit, there's buttons, there's moving parts, and a lot of men are left wondering, how on earth am I supposed to put my penis in that? So if that's you, don't panic. Almost everyone feels awkward using it the first time. Let's face it, it does look like a medieval torture device, and it can definitely feel fiddly at the beginning. But once you understand the setup and practice it a few times, it becomes much easier and is surprisingly comfortable. If you'd like personalised guidance or support with using the Restorex, you can book a telehealth consultation with Restorative Health Clinic from anywhere in the world using the link in the description below. The most important thing is to go slowly, follow the instructions and not force anything. I'm Melissa Hadley Barrett from Restorative Health Clinic, and our team helps men with Peyronie's disease, erectile dysfunction, penile shortening, prostate cancer recovery and sexual health concerns every day. This video is general education only. Please always read the Restorex manual that comes with your device and follow the advice of your treating clinician. And stop if you have significant pain, numbness, skin injury, or anything at all that worries you. You should also get medical advice before using a traction device if you've had recent penile surgery, pelvic surgery, prostate surgery, active infection, wounds, or significant penile pain or reduced sensation, or just if you're unsure that traction is appropriate for you. Now, let's go through this step by step. Restorex is a penile traction therapy device. That means it gently stretches the penis over time. It may be used for men with Peyronie's disease, penile curvature, indentation, hourglass deformity, or penile length loss. Most men use it as a part of a broader Peyronie's disease multimodal treatment plan to increase length and correct a bend. It can also be used to increase penile length after prostate cancer treatment, pelvic surgery, or illness that has resulted in a change in the penile length. The key thing to understand is this. Restorex is not a quick fix. It works through regular and consistent traction over time. So the aim is not to pull as hard as possible. The aim is controlled, comfortable, repeatable traction. Now before you use it, the penis must be flaccid, not erect. Not semi-erect, but flaccid. That's important because the device is designed to be fitted when the penis is soft. So choose a time when you're relaxed, not rushed, and ideally somewhere private where you can sit comfortably. You will need your Restorex device, any padding or tape recommended with your device, and the instruction booklet. You may also want to mirror the first few times because it can help you see what you're doing. Step 1 is to measure your flaccid penile length. You need to do this before you set up the device properly. So what you need to do is place the ruler along the top side of the penis, and the end of the ruler here goes against your pubic bone. You may need to gently press this into the fat pad so you are measuring it from the pubic bone, not just from the skin. Then measure the penis while it's flaccid by stretching it out like so. This measurement helps you work out whether the standard rods are suitable or whether you need to use longer rods that come with the device. In the Restorex system, if your flaccid length is longer than the device can comfortably accommodate, you may need to change to the longer rods that come in the box. The manual explains this in details, so please check your booklet carefully. If you do need to change the rods, there are screws at the back of the device. You remove the screws and swap the rods over and secure them again. Do not over tighten them, but you do need them secure. You don't want to damage the device, so be gentle. If you are not sure, stop and check the instructions or ask for help. Step 2 is to get familiar with the device before you put it on your body. This makes a big difference. Spend a few minutes just holding it and learning what each part does. There is a base that sits against your body. There are rods that allow the device to extend. There's a clamp that holds the head of the penis, and there are release buttons. There is also a spring tension system, which when you push the device together and then extend it, you're creating traction. On the device, there are some white lines that you can see here. These lines help you understand whether there's enough tension. The basic idea is that when the device is properly under traction, those white lines should not be visible. If the white lines are still visible, like that, it means that there is not enough spring tension and you may need to extend the device further using this mechanism here at the base. I know this sounds confusing when I say it, but when you actually have this device in your hands and you practice moving it, it starts to make sense. So before you put it on, practice this movement. Push the device together, extend it, watch the white lines release it. Do that a few times. You want to understand how the traction works before the penis is in the device. Step 3 is positioning yourself. Sit down in a chair and bring your legs fairly close together. This helps support the device while you're fitting it. You may find it easier to sort of lean forward slightly. Make sure your testicles are out the way and hanging down comfortably. You don't want your scrotum or your testicles trapped in this device. Take your time here. This is not something to rush. Step 4, remove the clamp end like this. Push that and take it out and put it to the side. Then put the base of the device against the pubic area. The penis then comes through the opening of the device. The device should be centered and stable. At this stage, you are not trying to create traction yet. You're just getting the device positioned comfortably against the body. Step 5 is preparing the head of the penis for the clamp. This is the part that many men find fiddly at first. The clamp holds the head of the penis, also called the glans. You may use the padding or the tape that comes with the device, depending on what your manual recommends and what feels comfortable for you. Some men find that the padding is more comfortable and it just slips over here, and others find it more comfortable if they tape around the head of the glans. Some men need to experiment a little to work out what gives enough grip without too much pressure. The aim is to protect the skin and make the clamp more comfortable. At Restorative Health Clinic, our patients have found that the best way and the most comfortable way is to wrap the self-sticking bandage around the clamp head, like here. Insert the flaccid penis through the base. If you have a foreskin, gently pull the foreskin back before placing the head into the clamp. This helps prevent the foreskin from being pulled or trapped. Now, look at the head of the flaccid penis. The clamp should sit on the glans like so, not down over the rim or the base of the glans. That rim is called the corona. If the clamp is too far back over the corona, it can be uncomfortable or painful. So you want the clamp positioned forward enough that it holds the head of the flaccid penis securely, but without pinching this sensitive rim. This may take a little practice, and that's very normal. Step 6 is closing the clamp. Place the head of the penis into the clamp as described above. Make sure the skin's not folded awkwardly. Pop it down and click. Also make sure that the clamp's not catching pubic hair or any other loose skin. It should feel secure, but it shouldn't feel painful. A firm pressure is expected. Sharp pain is not. If it hurts, release it by pressing that button and try again. Do not try to push through pain. Pain is a warning sign, not a sign that the device is working better. The old saying, no pain, no gain, does definitely not apply here. Step 7 is attaching the clamp back into the device. Now this is tricky for me to show here because this is obviously not a real penis, but once the head of the penis is secure in the clamp, you stretch this clamp forward and push the clamp back into the device like so. It can feel a little awkward the first few times, so if you're trying to hold the device steady, keep the penis positioned and click the clamp into place. Go slowly, and if it slips out, reset and try again. It doesn't mean you failed, it just means you are learning. Most men get better at this with practice. Now I know I've made this look a little bit tricky, but that's because this isn't a real penis. It's much easier with a pliable flaccid penis. I've taken the penis out now for the rest of it because it's too hard to show you. Step 8, applying straight traction. Once the clamp is secured in the device, gently push the base of the device back against your pubic bone, and then it will extend like this until traction is applied. You need to check for those white lines we talked about. If they're still visible, you push it back in again, it'll click, and then you need to look at the base here, and if you have a look, you can see this, and you can feel underneath, and then you open it and extend a little bit at the base, which makes it longer. like so. Then you do it again, extend the springs for the traction, and if it's far enough, the white lines won't be visible, and you know that you're spring-loaded and you're under traction. You should feel stretching and tension, but not sharp pain, numbness, or any feeling that the skin is being pinched, trapped, or pulled too aggressively. If anything feels wrong, stop, release the device, and reassess. Now, if your main issue is penile shortening or loss of length, you may use the device in just this straight position. That means the penis is being stretched straight out from the body. For many men, this is where they begin, and for the first week, many protocols focus on straight traction before adding counterbending. Your own plan may be different, so follow your clinician's advice and the device instructions. Now let's talk about curvature. If you have Peyronie's disease and the penis curves upward, downward, or to the side, Restorex can be adjusted so that the stretch works in the opposite direction of the curve. This is called counterbending. For example, if the penis curves upward, the device may be positioned to gently bend in the opposite direction. If the penis curves to the left, the counterbend is to the right. If the penis curves to the right, the counterbend is directed to the left. The goal is not to crank the penis aggressively in the opposite direction. The goal is controlled traction in the opposite direction of the curve. Gentle, steady, consistent. With Restorex, there are a couple of ways to manage a side curve. Some men adjust the rods, so these rods here, and this is how they explain it in the manual, can be turned around. Others find it easier just to rotate the device on the body so the counterbending direction matches the curve they are trying to correct. Your manual shows how the device can be adjusted for different curve directions. If you're not sure which way to set it up, this is exactly the sort of thing we can help you with at Restorative Health Clinic via telehealth. Now let's talk about timing. A common Restorex routine is 30 minutes twice a day, depending on the treatment plan. But please do not assume you need to start with this full amount straight away. If you're new to it, start gently. You might begin with 10 minutes. Then, when that feels comfortable, increase it to 15 minutes. Then gradually build toward the routine recommended for you. For Peyronie's disease, some men eventually work towards a session that includes straight traction and then counterbending. For example, they may do part of the session straight and part of the session bending the opposite way to their curve. But you may not be ready to do this bending part on day one. Most men need to get used to straight traction first. That's okay. It's better to build up gradually than overdo it and stop because you're sore. Consistency matters the most. The men who tend to do the best with traction therapy are not the men who pull the hardest. They're the men who use it regularly and safely. So if you miss a session, do not panic. Just get back to your routine. Do not try to make up for missed sessions by using it for too long or too aggressively. More is not always better. Harder is not always better. Pain is not progress. Now, while the device is on, you may feel stretching, pressure, or a firm hold at the head of the penis. That can be normal, but there are some warning signs you should never ignore. Sharp pain, numbness, trapped skin, or the glands becoming cold, dark, or extremely uncomfortable are all signs you need to stop immediately. And if something doesn't feel right, stop, remove the device, and check everything before continuing. Release the device, check the skin, and take a break. If the symptoms don't settle quickly, or you are worried, seek medical advice. Now let's talk about removing the device. Do not just pull it off. First, release the traction and bring the device back to neutral. Then, open the clamp gently and release the head of the penis. Check the skin. It is normal for the area to look a little compressed for a short time, but it should not be bruised, cut, numb, or painful. If you are repeatedly getting pain or skin irritation, something needs adjusting. It might be the padding, it might be the clamp position, it might be too much tension, it might be the duration, or it might mean the device is not right for you at this point. Please do not just keep forcing it. Now I want to give you a few practical tips that can make this easier. Tip number 1, trim long pubic hair. You do not need to shave everything, but if the hair is long, it can get caught in the device and that can hurt. Tip number 2, use the padding properly. If the clamp feels too harsh, check whether you are using tape or padding correctly. Small changes can make a really big difference. Tip number 3, make sure the foreskin is pulled back before clamping. This helps avoid painful trapping. Tip number 4, make sure the clamp is not sitting over the corona. If it's too far back, it can be very uncomfortable. Tip number 5, do not use the device with an erection. It is designed to be applied when the penis is flaccid. Tip number 6, do not rush. The first few times are about learning the process. You are allowed to be slow, you're allowed to be awkward, and you are allowed to need a few attempts. Tip number 7, keep the device somewhere visible in the house, if that helps you to remember, or set an alarm in your phone. The success of traction therapy depends heavily on actually doing it. Buying the device doesn't change the curve or the length. Using it consistently is what gives you the best chance of improvement. Now, I just want to talk about expectations. Traction therapy is not instant. You will not use it once and suddenly have a straight, longer penis. For Peyronie's disease, penile curvature and length changes have usually developed over time. Improvement also takes time. Most men need to think in terms of months, not days. You may take photos or measurements at intervals if your clinician recommends that, but do not check it obsessively every day. That can make you anxious and frustrated. Look for gradual change over time, and remember, Restorex may be one part of a broader treatment plan. Some men may also need erectile dysfunction treatment. Some need medications and injections. Some may also need shockwave, pelvic floor work, testosterone review, or surgery in more severe cases. Some may simply need monitoring and education. The right plan depends on the person. So to summarise, use the Restorex when the penis is flaccid. Measure and set up the device properly before the first use. Make sure the testicles and the scrotum are out the way. Use padding for the head of the penis if needed. Pull the foreskin back if you have one. Place the clamp on the head of the penis, not too far back over the rim. Apply traction gently. Use straight traction first, unless your plan says otherwise. Add counterbending only when appropriate and as instructed. Build up gradually, use it consistently, and stop if there is significant pain, numbness, skin injury, or anything that worries you. If this feels difficult at the beginning, please don't be embarrassed. Almost everyone finds it fiddly at first. This is a medical device being used on a sensitive part of the body. It's completely reasonable that you need guidance. At Restorative Health Clinic, we help men work out whether Restorex is appropriate, how to fit it, and how to use it safely, and how it fits into their broader Peyronie's disease or penile rehabilitation plan. So if you have the device sitting in a box and you are too nervous to start, or you tried it once and gave up, please get help. You do not have to figure it out alone. I'll put the links below for appointments and more patient resources. I'm Melissa Hadley Barrett from Restorative Health Clinic. Thanks for watching, and remember, Peyronie's disease and penile length changes are common. Help is available and there are practical things you can do. I'll see you in the next video.